everybody. My name's Laura Amelia. I'm the Director of Transplant Nursing here at Boston Children's. And today we're taking over Snapchat and we're going to show you what it's like to go through the transplant evaluation, inpatient and hospitalization for a transplant.
During the evaluation, patients meet with many different professionals who have different roles within the multidisciplinary transplant team. The team reviews the patient's case, history, and eligibility for transplant. Evaluation can take 1 to 3 days. At the end, the team meets and will share the recommendation with the family to develop a plan of care.
Hi, my name is Julie and I'm one of the transplant coordinators. I wanted to talk to you today about listing your child. So if your child is deemed eligible by the transplant team for organ transplant, we will place them on the list, and that is my responsibility. The list is a computerized national organ database. So the process of listing is just to put your child's name on this list. Then once the child is listed, we need you to make sure that they are ready to come to Boston Children's Hospital anytime an organ is available.
Oh, it's Eunice with an organ offer. It's my job to make sure we get the best organ possible for our patient. Sometimes our organ teams go to the organ by either flying or driving to bring back the best organ. It's my job to share the exciting news that the organ has become available. Hi, it's Dr. Lee. It's time for your organ.
Hello, Diane, right? So happy to meet you. I'm Joanne. I'm your nurse today. And Mom, what's your name?
Christy.
Nice to meet you, Christy. I'm glad you made it here. Had a good ride?
Yep.
Good. So I'll just let you know a few things that are going to happen, okay? We're just going to do some vital signs to start. Nothing exciting. And then we'll ask a few questions. And then some doctors will come in. The transplant surgeon will come in. And the anesthesiologist will come in and they'll explain everything to you. And they'll have you sign some papers. There may be a few other people in and out. Do you have any questions?
Can we bring Bear?
You can bring Bear. So when the pre-op area calls us when they're ready, we'll get you ready into the bed and we'll bring Bear with us and we'll take a ride down there together and Mom can come too. Okay? Great.
Waiting for their child to come out of their surgery, see if they need anything, also check if they're doing okay, and also see if there's any resources that they need.
So great news, the transplant has occurred. The patient's now recovering in the hospital, and each patient's hospitalization length is determined on what kind of organ that they receive. And from the beginning, the discharge teaching starts, and we want the patient to be prepared and comfortable to go home.
When patients leave the hospital for the first time, they feel pretty insecure and scared. So I do the very best I can to reassure them and know that we're there for them. I tell them I am now officially part of their family and that they should call me for anything.
Hi, my name's Kate. I'm the Transplant Infectious Disease Nurse Practitioner, and my job is to help keep you safe and infection-free after transplant. One of the best pieces of advice that we can offer you is to wash your hands very often and very well to help stop the spread of infections.
Hi, my name is Kiara and I'm your Transplant Financial Coordinator. At the time of discharge, we just want to make sure that your insurance stays active and you stay healthy.
Hi, my name is Alana. I'm one of the transplant pharmacists. So prior to all of our transplant patients going home, I help the patient and the families become fluent in their post-transplant medication regimen, including the medication name, the dose that they're going to be on, when to take their medication, and review some of the common side effects. And most importantly, we always make sure that the patient and the family is walking out of the hospital with all their post-transplant medication in hand and their pill boxes filled.
Hi, my name is Jessica. I am the dietitian for the lung transplant program here at Boston Children's.
Things that I like to work with families on is coming up with a plan for their child's nutrition to keep them as healthy as possible throughout the whole transplant process. Things I like to teach about at the time of discharge are kind of like the big reminders. So making sure that fruits and vegetables are washed really well, that meats are cooked really well, and that overall we're just keeping the whole kitchen and eating environment healthy and clean.
So right before discharge, I'll talk to families to make sure that they're okay, and also I will make sure that they're able to get to clinic once they're outpatient. And if there are any issues, I'll help resolve them. Also, I'll help them with numbers that they'll need to know for how to reach the transplant team on nights, weekends, and holidays.
Welcome to Transplant Clinic. After discharge, transplant patients come to clinic on a regular basis. They get labs drawn with each time, and each time that they're here, we talk about their weight to make sure that they're gaining weight appropriately, and of course, we're talking about medication compliance to make sure they're taking their medications as prescribed.
Yeah? Do you get out every day? No, some days you don't feel well enough to go? Okay, and you're not going to school at all, not even for like a little bit of the day? Okay.
Just homeschool.
Oh, you're doing the homeschooling. Okay, so a tutor comes every day or mom does it?
Come here. Come here, Simone.